This year's program, I think, is very exciting because we have now for about a decade had new targeted therapies, and we're learning more and more how to use them. And this is where personalizing therapy comes in. So we are increasingly testing tumors for targets. We are sometimes testing patient materials to predict what patient might better tolerate a certain treatment, might need higher doses of a certain treatment or lower doses. And as the information from the basic science evolves and increases every year, we are approaching a threshold where truly the science that can be presented in the clinical arena is starting to reflect the basic science and influence how we treat individual patients. This year, the number of abstracts submitted was 4,400 about. And of that, about 60% are chosen to be included in the program. 4 abstracts are covered on the scientific plenary session on Sunday afternoon. Those are discussed individually. It should be an exciting presentation and session this year. Another 208 are placed in oral presentations throughout the program, beginning Friday afternoon. And those are really the key presentations, frequently followed by discussions. And another 500 or so are in poster discussion sessions, where the presentations are grouped, but at the end of a viewing of the posters are discussed by a group of discussants, usually 4. And then there's another 1,500 or so that will be shown as posters. We think that some of the presentations that will be covered in the scientific plenary session will be practice changing or practice influencing. For example, there will be a presentation about PARP inhibitors. Now, that may be too early to be practice changing, but it is clearly a very exciting new target where interfering with DNA repair at the cellular level following an insult, cytotoxic chemotherapy, may alter in the future outcome. There will be new information on how bevacizumab as an anti-angiogenic therapy should be used in the adjuvant setting in colorectal cancer. We will hear about an anti-idiotype vaccine for follicular lymphoma, and then an exciting presentation that will deal with how should we follow our patients. And so for ovarian carcinoma, can we use a biomarker to follow patients, and using that detect recurrence or progressive disease earlier, and does that make a difference in taking care of these patients, say as opposed to following them clinically?
One of the things that we all as members of ASCO have realized is that we are a victim of our success. There's a fair amount of knowledge expansion, and there are so many topics to be discussed. And so this year, the challenge that we put forward in front of the tracks is to come up with a program that is very much focused on science, very much focused on evidence, very much focused on different aspects of how we take care of our patients, whether one is a researcher or one is a practitioner or one is in training. As a clinician and a clinical researcher, I firmly believe that our mission for our patients is to provide them with the best possible care, quality care. That has to be grounded in science and evidence, but we also have to pay attention to cost of care and personalizing care. And a lot of the care cannot be happening by just the oncologist, but rather by a team of professionals, which is the multidisciplinary team. So conventionally, when we think of multidisciplinary team, we think of the radiation oncologist, the surgeon, the med-onc. In reality, the team is much bigger. So this year, I think one of the features that I'm excited about is partnering with other sister societies like the RSNA, trying to integrate, for example, imaging into the everyday care of patients, but also in the research arena, and then facilitating the interactions with between the the clinicians and the radiologists to try to see how, for example, imaging can be implemented in patient care. As you know, as we get bigger in terms of membership and in terms of topics to cover, it is very difficult to stay focused, and yet what we try to do is take into account all of the input that we've had from members on prior programs and try to come up with a program that is very much focused, not so repetitious, but at the same time touching on key aspects of what we feel is important. Irrespective of what your background is, whether you are a nurse or whether you are a medical oncologist or whether you're a surgeon or a rad onc, whether you are in training or whether you are in research, you will find through the breadth of the topics areas of interest that are covered. So we're hoping that that satisfies the needs of our members and attendees.